Hello, today we'll talk about tuberculosis of bone and joints. So the contents are introduction, TB spine, TB hip and TB knee. So the basics of tuberculosis is the most common site affected is lung followed by lymph node. The type of spread is hematogenous. The bone spread, the most common site is spine followed by hip and followed by knee, SHK. The names associated with tuberculosis is TB spine is known as Pott's spine, TB shoulder is known as caries sicca, TB digits is known as spina ventosa. So first we'll talk about TB spine, which is also known as Pott's spine. It is a two vertebral disease because the common segmental artery arises from same mesodermal somite. It affects the vertebra and disc and it affects the anterior portion of the spine. The clinical features of TB spine are chronic pain, nocturnal symptoms. The first symptom is pain, first sign is tenderness, and first neurological sign is increased deep tendon reflexes. In X ray or MRI, we can see paradiscal lesion. The gold standard for diagnosis of TB spine is CT guided biopsy. The treatment is middle path regimen, which includes rest and anti-tubercular therapy. In anti-tubercular therapy, there are two phases: intensive phase and continuation phase. The intensive phase is for 2 months, which includes isoniazid, rifampicin, ethambutol, and pyrazinamide. The continuation phase lasts for approximately 10 to 16 months, which includes two drugs, isoniazid and rifampicin. The total duration for anti-tubercular therapy is approximately 12 to 18 months. Indications for surgery: bladder involvement, increased neurological deficit, and no improvement in conservative management. Surgical methods for treatment of TB spine include anterolateral decompression and bone grafting or anterior decompression with bone grafting. We are never supposed to touch the posterior in Pott's spine. Next, we'll talk about TB hip. The stages of TB hip are synovitis, early arthritis, late arthritis, wandering acetabulum, and fibrous ankylosis. The first stage is synovitis, which has Faber lengthening. Faber stands for flexion, abduction, and external rotation. Next is early arthritis, the second stage, which includes father. Father means flexion, adduction, and internal rotation. It is seen in both early arthritis and late arthritis. So the difference is in early arthritis we see less than 1 centimeter shortening, and in late arthritis we see more than 1 centimeter shortening. The fourth stage is wandering acetabulum. It is a misnomer because actually it's the femur head that wanders, not the acetabulum. The fifth stage is fibrous ankylosis. The first radiological sign is periarticular osteopenia or pestle motor sign. Treatment of TB hip. The first two stages, the treatment is rest and anti-tubercular therapy. For stage 3, 4, and 5, we do arthroplasty or arthrodesis. Most common site of TB hip is acetabulum. Most common site of TB in femur is Babcock's triangle. Next, we'll talk about TB knee. The symptoms include gradual pain, knee flexion, and synovitis. Radiological sign we can see synovial proliferation and synovitis. Complications of TB knee is triple deformity. Triple deformity includes posterior subluxation of tibia, external rotation, and knee flexion. So, triple deformity is also seen in other diseases, like we have a mnemonic for that: triple T for TB, R for rheumatoid arthritis, I for iliotibial contracture, P for polio. Iliotibial contracture is seen in polio. Low clotting power, excessive bleeding like hemophilia. Now, some terms. Arthrodesis means surgical fusion. Ankylosis means pathological fusion. So, ankylosis, there are two types: fibrous ankylosis and bony ankylosis. Fibrous ankylosis is painful, FF. TB hip, it is seen in TB hip and knee. Bony ankylosis is painless, solid, seen in septic arthritis, TB spine, and ankylosing spondylitis. Solid, septic arthritis, spine, TB, spondylitis, ankylosing spondylitis. Recall questions.